Hi everyone, it's Amanda here. Welcome back to Yachting International Radio, and this is Inspirations with Amanda. And I'm really excited today. I'm introducing you to my friend Edi Albert. We worked together in emergency medicine years ago, and since then we've both gone off to do all sorts of incredible things. And Edi's done some really amazing things. So he's a doctor and he works in extreme medicine, as you know, something I'm really passionate about. However, without further ado, Edi, I'll let you introduce yourself. Who are you? Where are you? What are you doing?
So thank you, Mandy. Yes, so I'm a medical doctor, perhaps with a difference. From an Australian perspective, which is where I am now, I'm what's known as a rural or remote generalist, which is another way of saying a bit of a jack of all trades. But certainly, I've worked in the Australian outback with Aboriginal folk. I've worked in the voluntary capacity in the Himalayas. I've worked down in Antarctica with our National Antarctic Research Program. And right now, I'm about as far away or far removed from where you are, Amanda, in that I'm actually in the biggest ski resort in the Southern Hemisphere, which, believe it or not, is in Australia. We do have mountains that go up to 2,200 meters. We have quite a few ski resorts and a lot of keen Aussie skiers. And normally people from around the world will come here and ski in the off season, as it were. So yeah, I work in the medical clinic here, fixing up, patching people who blow themselves up on the ski slopes, on their snowboards, or on their skis.
Amazing. And I hear you've had a bit of a dump there recently. How's the snow?
Yeah, I suppose if you're somewhere like Fernie or Hokkaido, the idea of getting 95 centimeters of snow over 3 or 4 days really doesn't actually excite you. But when you live somewhere where it's relatively warm, mild, sort of maritime influence on our mountains, to get that sort of dump, we're pretty excited. The snow's been so silky. I was backcountry yesterday. The day before yesterday, just on my own. Nobody else around, some steep turns, first tracks, silky snow. It's like, this is amazing. So we get it sometimes.
Yeah, we do. I love Perisher. And I think you're playing it down a bit. You also do some amazing work with the Flying Doctors. Is that correct?
Yeah, I've spent a few years with the Royal Flying Doctors Service. So I guess for people around the world, there's not many first world countries. It's really only Australia and Canada that have a kind of first world sort of set up an income level and expectation of medical provision that actually have their huge centres of population concentrated in relatively small areas, and then these vast areas of, you could call it untouched wilderness. It's not quite right, but certainly massive areas, very small remote populations, indigenous populations. We share a lot of similarities really with Canada, except they get more snow and it's really cold and dark, and our areas are just very, very hot and red and dusty. But the medicine's the same, logistics.
Sorry, there was a delay. Keep going.
I was going to say the logistics are sort of the same, and the difficulties of trying to provide a first world medical service into such remote areas means it gets quite expensive, and certainly you need, again, quite a diverse skill set to be able to sort of fly out into the middle of nowhere and deal with whatever you're going to get.
And what would be the most exciting rescue you've done with the flying or transportation that you've done with the Flying Doctors?
Oh, the most exciting. I'm not very good at, people always say, pick your favorite this, pick your best that, I'm not very good at doing bests and favorites and worsts. I guess there's memorables, and perhaps 2 weeks into the job was a gentleman who was having a really low time, and he decided to end it all and shot himself in the chest. And as he did so, his big toe slipped off the trigger of his shotgun. And he failed to kill himself. And about an hour and a half later, we were sort of landed. He was a mess, put chest drains in, did what we could, and flew him down to Perth. So bearing in mind, it's an hour and a quarter's flight in a fixed wing aircraft to get to him. And then from taking off, it was another 2.5 hours flight to the nearest large hospital. And within about 15 minutes of getting them there, he was in theatre. Cardiothoracic surgeons have opened it up, decompressed the bleeding around his heart, and saved his life. And what was really nice was that he actually, as he woke up, it was, oh shit, I'm glad I'm alive. This was a mistake. I really didn't mean to try and kill myself. That was a bad idea. So intervening like that and actually, having really glad that we actually managed to save his life, that was pretty good.
That's so cool. Yeah, what a good feeling. Amazing. And tell us about Antarctica. What was your position down there and how did you get there? How long were you there? What were you doing?
I suppose appropriately, I got there on a ship. I've been down a few times. The first couple of times we were just ship-based scientific voyages. So on the Aurora Australis, which is shortly to be decommissioned, it's been in service for a long time now, and we're getting a new icebreaker. But certainly a couple of marine science voyages, floating in amongst the ice, seeing all the wildlife, working with scientists and helping them on their projects. Because, as you would know, if you prepare a crew, if you prepare a ship, you get everything right before you even set off. There shouldn't be too much in the way of medical problems, once you're underway. So working with friends that were scientists, that was really quite interesting. For me as a doctor, getting to be involved in marine biology projects and seeing what they were doing was fabulous. And then a trip that was 6 months working at one of the stations. So again, ship down and then last flight home. And then the last trip I did was actually more of a play trip on a 70-meter yacht, so a French designed aluminium centerboard yacht, perfectly set up for getting down to Antarctica, perfectly set up for moving amongst the ice. I had a 40-day trip, doing a bit of exploring, a bit of climbing, a bit of skiing, even a bit of swimming and a bit of snorkeling.
Wow, snorkeling in Antarctica.
Yeah, it wasn't too bad actually. The dry suit and neoprene hood, and my feet got a bit cold, but I was in the water for about 40 minutes, and saw a bit of sea life. There wasn't that much around where we were, but having been on that scientific voyage before and seen the incredible amount of sea life that's around the coast, soft corals, sea pens, all these weird fish that we never knew existed. So my little snorkeling effort, I think I saw some starfish and a few mollusks, and that was about it. A bit of seaweed, and that was about it.
No Japanese starfish, I hope.
No, the whole crown of thorns you're referring to.
Yeah.
Yeah, no, I've seen crown of thorns before, but no, not down there.
I remember we used to have to dive and get rid of them because there were so many around our sailing club in Hobart, Tasmania, where I grew up. And what was any exciting injuries that you had to deal with in Antarctica? What are the main, because we have a lot of super yachts going down there at the moment, maybe not right at the moment for obvious reasons, but every year more and more super yachts are heading down there. So what can you expect and what did you come across?
So in terms of maritime traffic, there was actually quite a lot. And what was really quite clever was the professional or proper charter ships that were taking passengers down there, and how well scheduled they were. So you'd watch one pull out from around a headland and appear into the bay, and to them it just seemed like, well, there was only us there in our yacht, and how cool and how remote. Yet only 15 minutes before, we'd seen another big cruise ship slip out. So there's this amazing kind of sort of sliding doors things of how they try to create an illusion of remoteness and how special it was for these people. Whereas what we actually saw was this very cleverly crafted, stage manipulated show of just boats moving in and out. So that was quite funny.
Wow.
Coming down to, I suppose you kind of keep focusing on the injuries, and it was a bit sad for myself and my wife. We were there to try and go climbing, and we climbed a peak. We think we might have been second or third ascent, doesn't really matter. Not that high, only about 750 meters off above sea, but we'd got out of the dinghy from the yacht, immediately strapped crampons on the beach, and was straight up. And we skinned up. We had mountaineering boots, so instead of having normal skis, we had short blades. They're only about 1 meter long. They fix differently to what's effectively a mountaineering boot, not a rigid ski boot. But we got to the top, great, looking all around. We could see the yacht, tiny pinprick below. And as we sort of set off, my wife, Deb, caught an edge, went over and broke her ankle. So there we were, 50 meters below this peak with a broken ankle. And to me, I think two things: you can overcomplicate medicine in a remote environment, whereas you should actually be trying to simplify things. You know, exactly what she'd done didn't really matter. She just couldn't get up. There's no x-rays, there's no diagnosis. It was can't get up. Ankle's probably broken. Yeah, that's all you really need to know. So the focus is then like, what do we do next? Not faffing around with the patient so much. And the other thing was the utility of having decent painkillers. And I know that's an issue in our modern society, where we worry too much about people taking opiates and getting addicted. But in this setting, giving a decent slug of intramuscular morphine, and then just getting on with dragging her backwards down the slope for the next 3 hours, readying onto the boat. We had you'll laugh about this, we had our rescue stretcher was from the Melbourne Toboggan Centre. We had a couple of little toboggans that were about 4 feet long that we thought we could use as pulks for putting our equipment on and dragging behind us, or if we needed it, we had a rescue sled. So a couple of guys from our friend Dougie came off, and they sort of met me at the bottom of the mountain, and we popped her on that and dragged her back to the boat. I've still got some photographs of her sitting up, and in the background there's these Antarctic fur seals also sitting up in the same sort of position. So yeah, that was a bit of a challenge. And then because we had a couple of four folk were off on another island climbing, we were picking them up in 5 days' time. She was pretty stoic, just sat on the boat in a plaster. And it was 10 days before we got back to Ushuaia, and then another couple before she had an operation. So I think it comes down to just like, what's the problem? How do I fix the problem? Not overcomplicating it and just getting on with it.
Yeah, really good advice, because as you know, in marine medicine and in the super yachts, they're all very remote, Patagonia, St. George's Sound, the Northwest Passage, Antarctica, Mid-Atlantic even, which for us we call the milk run. We're back and forth all the time. You can be very remote out there. And while you were down there, was it another, and we were talking the other day about a tragedy where there did a boat capsize or?
Yes. So in the way that the world's often very small when you get into niche market stuff, and certainly the Antarctic yacht. And by yacht, I'm talking about, we're talking about yachts with masts and sails. You're talking about vessels that are perhaps 55 to 80 feet long, maybe. So proper yachts in the traditional sense of the word. Yes, unfortunately, we were on our way back across Drake Passage, and we'd got a bit of a message that friends of ours, their mother and the skipper on that yacht, they were coming back from Falkland Islands. Forget where they're headed. It might have been Montevideo. I can't quite remember. But from just in South Georgia, Falkland Islands, heading back towards South America. And there's that term, the term freak wave, when we actually all know that every 1,000th wave is twice the significant wave height. So it's not really a freak wave, is it? But anyway, they were in the back, they were in the cockpit, small cockpit in the back of the boat, a couple of peeling potatoes for dinner. And the skipper and his girlfriends, this was the mother of the friend of ours, were washed overboard. The other lady, who was a client on board the boat, slammed her head into the metal stanchion or something around. I'm not sure, something around the cockpit, but managed to stay in. And then, despite best efforts, they turned around, started the engine, got the sails down, had motored back to sort of try and find them. They'd found the skipper, and they'd thrown the life raft overboard, and it deployed as it should have done. And then they sort of went around again to try and come back and get to him. By the time they came back, he wasn't anywhere to be seen, and she was certainly long gone. So it was really quite a tragic event. And I guess it reminds us that whenever you set off and you go somewhere like that, there isn't actually a guarantee that you're coming home. We think we live in this world where everything's automated, everything's guaranteed. You go to the supermarket, you buy your bread. You go to the petrol station, you buy your petrol, everything's on demand, give them a credit card. But yet, when you get on a boat like that and you go to places like that, nothing's actually guaranteed. And it was quite sobering coming back into Ushuaia, and again, all the yachts are all lined up in the yacht club, and the amount of the collegiality and the kind of support, that emotional support, and the sort of friendship between essentially rival yachts, because they're all operating on getting punters, getting passengers to take down there. But yet, when times are tough, everyone's pulling together, and the amount of the tears and that was shed, the wine that was drunk, it was quite a difficult time, especially as my wife was in hospital having her ankle broken. So yes, yeah.
Yeah, thanks for sharing. I think it's good for us to remember that we're all in a high risk industry, and these things, and it's beautiful because we get to explore these amazing places. But I like the way you put it so well, that there is a risk when you run away from the automated lifestyle, I guess, that unfortunately, yeah, it's not always that way. But what a way to go as well. At least if you go in the water there, it's going to be quick. At least you're not going to be bobbing around in the Atlantic for hours, waiting for the rescue.
Yeah, in a sense, I think both of them. Yeah, I think both were in the late 60s or early 70s. I can't quite remember. And it was sort of like, well, at least they've had a good life. And it was like, no, I don't want to die in my late 60s. No, that's not good enough. But I guess they died doing what they loved.
Exactly. I've got I know a lot of friends that don't wear life jackets in the Southern Ocean, because when they go in, they want it to be forever. They just think, well, if I'm going in, I'm going in. What do you think about that?
It's all pretty context dependent, isn't it? Because if it's blue, flat, calm, and you go in, that's probably when you got the best chance of actually a boat coming around and fixing you. But it's also the last chance, the slight lowest chance you've got of falling in the first place. It's also it's probably when you probably wouldn't have a life jacket on. Tethers, I guess, are the other issue, aren't they? If you're going up onto the foredeck and things are pretty rough. We had one downwind sail where the wind really picked up beyond what we expected, and for some reason, and I wasn't, it's not my yacht, I wasn't in charge, but for some reason we didn't have any lanyards or any tethers on board the boat. And so a friend and I were sort of going forward in sort of 45 knot winds, trying to sort of get the mainsail down, headsail, everything wrapped up, so we were just on bare poles. We didn't have life jackets on, but geez, I was definitely in the moment. I was definitely very, very focused on what I was doing and the moves I was making. So I don't know to what extent we have these artificial things that then maybe give us a bit of complacency. I don't know.
Yeah.
Things are never that simple. They're never that black and white as they are when they're seen on a TV show, that's for sure.
Yeah, absolutely. So on another topic, you are doing some really exciting work with the University of Tasmania, launching some grad dips and master's degrees in extreme medicine and extreme sports from a medical perspective, which could be really exciting for so many people watching this episode, because hopefully everyone that's watching today that's a yachty has done their medical support course, medical care on board ships, or at least medical
ships,
first aid at sea. So what we do is we train yachties to be doctors. But what you're doing is, and we're doing, is teaching doctors to be adventurers and be able to be leaders and medics in hostile and extreme environments, which could be so valuable for us as yachties, because I really believe that in the near future we're going to need many boats that we look after, having hospitals and needing doctors to be on board. I'm getting called every week asking to, you know, find a doctor for a super yacht. And there's definitely going to be a job opening there for many soon. If not every, I see in the future, every super yacht will require a medic, whether it's a paramedic or on the larger super yachts, you know, the mega yachts, they have dentists, they have operating theatres. One boat I was on fitting out recently had 3 oxy logs, for those of you that don't know what they are. They're ventilators. They were, you know, they had an operating theatre plus a dentist. They had the whole works, and more than we have in rural Australia and many rural places I've been. So, you know, there's going to be, you know, a lot of need for doctors on boats. But can you tell us a little bit about the course that you're running at the moment and what people are going to get out of that course? Because there could be some doctors and nurses and paramedics that are interested as well.
Yeah, so sure. So it's interesting saying about, you know, the extent of your medical capacities on ships. I guess the whole program really arose from working with Australian Antarctic Division, and going back some sort of 10, 15 years, it was getting to the point where it was actually very difficult to recruit. And Jeff Ayton, the boss doctor down there, yeah, we sort of put our heads together and thought, this is all about training. It's about recognition. It's about, yeah, giving people sort of something else. So we kind of ended up putting a program together that's sort of slowly grown. And from the outset, I was very keen it should be multidisciplinary. Because when you look at how healthcare is provided in different remote and extreme environments, it involves not just doctors, it involves nurses, paramedics. You know, paramedics taking an extended role into providing essentially sort of general practice type stuff. Equally with nurses taking a role out into that sort of pre-hospital environment, plus providing sort of ongoing care. You know, doctors having to actually get their hands dirty and be able to sort of function outside of a hospital. So we sort of built a program that sort of recognised and showcases some of what the Australian Antarctic Division does. It's been very good over the years at improving and its support for its ships and for its bases, the telemedicine setups. You mentioned operating theatres, training people, training the plumber and the cook and the diesel mechanic to be sort of theatre assistants. So sort of looking at some of what they were doing and then extrapolating that. So we try and teach people to function in not just cold, but hot environments, high altitude, maritime, aerospace. And, you know, from only a few short years ago, the whole space thing's taken off internationally. And certainly in Australia, we now have a space agency. So we run a course in space medicine. And as you mentioned, extreme sports. So going back to when I was a kid, yeah, the name didn't exist. But now when you look at what people are actually doing, you know, ocean racing is obviously one example, but also, you know, base jumping, wingsuiting, big mountain skiing, big wave surfing. And, you know, there's a lot of similarities, a lot of crossovers in the attitudinal stuff, the approaches that you need as a medic, as a caregiver, but also there's some very sort of specialist stuff. So we're trying to teach in a partly online environment, but also very much in face-to-face intensive settings of getting people together, trying to form them very quickly into teams that can function and respond. And particularly the doctors, trying to actually get their hands out of their pockets and get them to actually do stuff. It's often really quite interesting on the expedition medicine courses we run, where nurses are used to moving patients, paramedics are used to just getting on with it because their patients aren't neatly packaged. but particularly for the doctors to go, yeah, you actually need to do something. Your knowledge is not sufficient. You actually need to apply it, and you actually need to focus on what's important, as opposed to what's not important, and actually get something done. So often the medicine can be quite simple. You might have to draw on some specialist knowledge for different environments, but it's often very much about problem solving and being very practical. So I suppose I've been prattling on a bit, but that's basically what we're doing.
No, it's absolutely perfect and so relevant as well, because I find it really interesting the more I've been thinking about it, the role reversal of teaching. I've taught nurses and doctors and paramedics, advanced life support, and now I'm teaching the yachties, medicine, and they're also proactive. Except, I guess we have a couple of captains. Those of you that are watching probably know who I'm talking about. And one of my funniest examples of, hands in pockets was I said to a very good friend of mine that's a very famous captain one day, "Captain, could you get the medical kit, please?" And he turned to the chief stewardess and said, "Chief stewardess, go and get the medical kit." And I just thought that was hilarious and very well played. And so I find the yachties really easy to teach because they're so used to being hands-on and really, really busy. And I find it quite interesting when I go back to teaching in a hospital environment that, that sometimes they're not as proactive as maybe the yachties that are used to being in hostile environments, in extreme environments, and thinking on their feet, having to make things up as they go along, make a stretcher out of 2 deck brushes and a wet weather jacket or something like that. Yeah. So, but I think your students will be in demand in this industry, that's for sure.
Yeah. I just think you made me think of 2 things. One is I have some sympathy for the captain, because one of the things that we do teach is that whole, what came out of the aviation industry, perhaps, in the late 70s, 80s, this whole, what became cockpit and then crew, or we call it crisis resource management. So that overarching leadership. So sometimes we do want people with their hands in their pockets with a big picture view.
Yeah.
And then the other thing I sort of thought about was, as our modern society is getting more and more bureaucratically driven, more and more rules and regulations, seeing, I had an email from a friend of mine who's the medical director for a ski patrol outfit in northern Tasmania. It's only a small ski area. And then finding that some bureaucrat who runs the national parks is actually in control of what medical care is and isn't delivered when. And this sort of situation of, well, the ski patrollers are only ski patrollers when the lifts are running. And if the lifts are running, they're ordinary people. If they're ordinary people, they can't use the medications that they can use when they're ski patrollers. And they had this situation of a lady who fell and slipped. There was some ski patrollers there. They had their medical kits. And they were banned from using their skills because they weren't legally ski patrollers, because the lifts weren't running. So something that could have been dealt with very simply sucked up several police cars, a couple of ambulances, and had this lady in quite a lot of pain for sort of 4 hours. So we're finding young doctors, paramedics, nurses are kind of born and growing up in this sort of perverted society, where people are afraid to do the right thing in case they do the wrong thing, or are told they're not allowed to do the right thing. So we're having to not only get people and train them in this environment, we're having to give them a whole new mindset about what's possible and what should be done. And it contradicts what they're told in the rest of their lives.
So interesting, because that's something I find, I've got to keep pointing out to people here as well, that I'm a nurse in Australia, in England, in the UAE, but when I'm in Spain and on the dock, on a boat, I'm the same as the crew. And it's only if I come on the crew list and get appointed, and still then, I don't have any more skills, because so often people are asking me to help with things like that. And it can be really frustrating at times if you are being overrun. And I know the mountain you're talking about, and it is very remote up there. It's a big windy road and it's not always possible to drive it. So had it been anything more serious, it could have been quite a tragedy, really, if it was a heart attack or something. And I think with the legalities too, people are so scared, you know. So something that comes up in my courses is, you know, because we have so many medicines on the boats, as you know, that we're allowed to take around the world, but are only, you know, used offshore. And for anything else, we're supposed to take them to a local hospital, which often might be outfitted with the supplies we have. You know, the hospital I took a friend to in Vanuatu didn't even have sheets for the beds, you know. And once again, we're coming down to this legal framework of, are we allowed to assist or not, you know. And when the students I teach on yachts have all this training and they've done a couple of weeks of really intensive practice, and they can rattle off all the drugs we use, they know how to use their kits really well, they have quite sufficient kits in their car, and they come across a bike accident, you know, which we come across regularly here in Mallorca where I'm based, and they're not able to really give assistance in the way they're trained, because we train them in remote medicine, which is beyond basic first aid. And so it's always having to remind them that when we're training them for the boats, that we're only training them for remote marine medicine offshore. And we have to constantly remind them that when they're on the dock or when they're at the nightclub, that they are only able to do basic first aid and call for help, no matter what they see. Yeah. So one last thing, how do you get your head into leadership? If you're in a really crazy environment, say, let's use the ankle, because dealing with a loved one, many of us are in that situation when we're on boats. We work really closely together and we've been together for years. How did you cope, and how do you cope when you're in, you know, small groups of people that you've been training with for expeditions and someone gets injured? How do you get back in the game and get that medical hat on, so to speak, to deal with the situation pragmatically?
I think there's probably at a few levels. I mean, clearly you've got to have the knowledge skill set, but then beyond that, it's and that's often a relatively simple thing. And I think it's around being calm. So after I did my training, did my rural general practice training in Scotland, I ended up being in academic jobs for a while. Long story short, I hadn't done much acute medicine, much emergency stuff for a few years. And I decided, actually, I wanted to go back into that. And I had some anxiety about that. And, I wasn't lying awake at night. But it was sort of, well, when you see somebody who's short of breath, sweaty, things looking like pretty icy, it does get your heart rate up. Or I guess, you can extend that into a setting on a ship or a cliff face, or, there's enough going on that it gets your heart rate. A deliberate decision that I would always pretend to be calm and always pretend to know what I was doing.
Yeah.
And I think that sort of worked well, is to deliberately portray this sense of calm outwardly. It makes everybody else around you much calmer. It creates some space. There's rarely anything that needs to be done right now. There's not much in them that can't wait a few minutes. And I remember doing some training when the Royal Flying Doctors, every year we'd have to do some simulations, a simulated patient maybe out on a cattle station or a small remote nursing post, and they'd make them really hard. I remember I was with one nurse who was pretending to be she was the trainer, pretending to be the remote area nurse. We had the plastic mannequin doing whatever he or she was doing, trying desperately to die. I remember in the feedback, the doctor that was running it said, you're incredibly calm. And it's not necessarily because I knew exactly what I was doing all the time, or not necessarily because I felt calm, but if you can actually exude that calmness, it buys you some space, makes other people behave differently, they behave better. And I think it works really well. So that deliberately cultivating calmness, I think, would be one big message for anybody.
Love it. Absolutely. Yeah. I come back to the Dr. ABC there, just in a mindset way. You know, D for danger, don't flip out. Just keep it together, have a breath. You know, am I going to respond or react, you know, and just, you know, and I find just saying that Dr. ABC for me just helps me just stop, breathe and have a moment to, as you so beautifully say, just, you know, give out the calmness.
Yeah. I think maybe, I don't know, but the people you've taught might say one way or another, but maybe there's this sense that somehow you and I as professionals know something different and do something different, and that somehow this Dr. ABC nonsense is what we teach everybody else, but we have some secret stuff that we do.
Yeah.
And you're quite right, we don't. And when things are getting difficult, or you can't quite understand why things aren't going the way you expect them to, or if you're not getting the improvement you expect from your treatment, that's exactly what you do. You just go right back to the beginning and go, okay, where are we at with A? Where are we at with B? Where, yeah, and we do that all the time. It is real. It's not just what we teach other people.
Yeah, such a good reminder for everyone, and a reminder that, you know, nurses and doctors, especially doctors, are human too, and we actually have to consciously say, okay, this could get heavy. You know, there's huge waves coming over. It's blowing 60 knots and we're in 12-meter seas and someone's just broken their femur. Nothing has to happen in 1 minute. Let's just stop, make it calm, and do this together, you know, and calm the farm. And I can't emphasize that enough to students is, you know, it's the same when we go into a maneuver sailing. You know, you can be on a boat where everyone yells, or you can be on a quiet boat. And the quiet boat's always a lot more powerful and a lot more pleasant. Yeah. Well, thanks so much, Eddie. I know you've got powder to ski tomorrow and lives to save in the snow. Well, hopefully not, but you have to be at the hospital. So thanks so much for coming on the show. It's been really good having you here.
Thank you. Thank you for having me.
Such a pleasure. So everyone, this is Edi Albert from Perisher Valley in the snow in Australia, and you've been watching Inspirations with Manda on Yachting International Radio. Thanks so much, and we'll see you next time.